Understanding Depression Types, Symptoms, and Treatment. Welcome to our channel. Today we're diving deep into a topic that affects millions of people worldwide. Depressive disorder. Depression isn't just a case of the blues, it's a serious mental health condition that can impact every aspect of your life. Stay tuned to learn more and find out how you can seek help if you or someone you know is struggling. Major depressive disorder, when sadness takes control. Let's talk about major depressive disorder, or MDD for short. This is what most people think of when they hear the word depression. We're talking about a persistent feeling of sadness, hopelessness, and a lack of interest in things you used to enjoy. And it's not just a fleeting feeling. This is something that lingers day after day, week after week. Imagine waking up every morning with a weight on your chest, feeling like you're wading through quicksand. That's the reality for many struggling with MDD. Symptoms can vary, but common signs include changes in sleep patterns, either insomnia or sleeping too much. Appetite can be affected too. Some lose their desire to eat, while others find comfort in food. And then there's the fatigue, that bone-deep exhaustion that makes even the simplest tasks feel impossible. The impact of MDD goes far beyond just feeling down. It can affect relationships, work, and overall quality of life. People with MDD might isolate themselves, withdraw from social situations, and struggle to keep up with their responsibilities. They might experience difficulty concentrating, making decisions, or remembering things. MDD is not a sign of weakness. It's a real medical condition that requires professional help. There are effective treatments available, including therapy, medication, and lifestyle changes. Persistent depressive disorder, living in the shadows. Now let's talk about another type of depression called persistent depressive disorder, or dysthymia. This one's a bit trickier because it's not always as obvious as major depression. With dysthymia, the symptoms are often less intense, but they last for a much longer period, at least 2 years. Imagine a low-grade fever that never seems to break. That's what living with dysthymia can feel like. It's a chronic, low-level sadness that colors everything you do. People with dysthymia might describe themselves as feeling down in the dumps or chronically blue. They might have low energy, difficulty concentrating, and problems with sleep and appetite. Because the symptoms are less severe than major depression, they might not even realize they have a treatable condition. It's like carrying around an invisible weight on your shoulders, day in and day out. It's a medical condition that deserves attention and treatment. With the right treatment, people with dysthymia can find relief from their symptoms and start living fuller, more satisfying lives. If you recognize yourself in this description, please reach out to a mental health professional. Bipolar disorder, riding the emotional roller coaster. Now let's talk about bipolar disorder, a condition that's often misunderstood. Bipolar disorder isn't just about mood swings, it's much more complex than that. It's characterized by extreme shifts in mood, energy, and activity levels. We're talking about going from feeling on top of the world to crashing down into a deep depression, sometimes within a matter of days or even hours. Imagine being on a roller coaster that you can't get off of. During manic episodes, they might feel euphoric, have racing thoughts, speak rapidly, and have boundless energy. They might take on too many projects, spend money impulsively, or engage in risky behaviors. But then comes the crash. The depressive episodes in bipolar disorder are very similar to major depression, with feelings of sadness, hopelessness, fatigue, and loss of interest. Bipolar disorder is treatable. With the right combination of medication, therapy, and lifestyle changes, people with bipolar disorder can manage their symptoms and live fulfilling lives. Chapter 4. Seasonal affective disorder, the winter blues. Let's talk about a type of depression that's often tied to the changing seasons. Seasonal affective disorder, or SAD. This one tends to hit during the fall and winter months when the days are shorter and there's less sunlight. If you have SAD, you might notice your mood dip as the days get shorter. You might feel sluggish, have low energy, and crave sugary or starchy foods. You might find yourself sleeping more than usual, having trouble concentrating, and withdrawing from social activities. The good news is that SAD is usually temporary. As spring approaches and the days get longer, the symptoms typically start to improve. There are things you can do to manage SAD, like light therapy, regular exercise, and a healthy diet. If your symptoms are severe, it's essential to talk to a mental health professional. Chapter 5. Postpartum depression, beyond the baby blues. Now let's talk about a type of depression that affects women after childbirth, postpartum depression. Bringing a new life into the world is a beautiful thing, but it can also be incredibly challenging. Hormonal changes, sleep deprivation, and the overwhelming responsibility of caring for a newborn can take a toll on any new mom. Postpartum depression goes beyond the baby blues. We're talking about intense feelings of sadness, anxiety, and exhaustion that can last for weeks or even months. Moms with postpartum depression might have trouble bonding with their babies, feel overwhelmed by even simple tasks, or have thoughts of harming themselves or their infants. It's important to remember that postpartum depression is not a sign of weakness or a failing as a mother. If you're a new mom struggling with these symptoms, please know that you are not alone, and there is help available. With the right support, you can overcome postpartum depression and enjoy the special bond with your baby. Chapter 6: Psychotic Depression, When Reality Blurs. Now let's talk about a severe form of depression called psychotic depression. This is when someone experiences the symptoms of major depression along with psychotic features, like hallucinations or delusions. Hallucinations are sensory experiences that aren't real, like hearing voices or seeing things that aren't there. Delusions are false beliefs that are firmly held despite evidence to the contrary. Psychotic depression is a serious mental health condition that requires immediate medical attention. With treatment, people with psychotic depression can experience significant improvement in their symptoms. Chapter 7: Atypical Depression, Breaking the Mold. Let's talk about a type of depression that doesn't always fit the typical mold, atypical depression. Depression can manifest in different ways, and atypical depression is a prime example of that. While people with typical depression often experience loss of appetite and insomnia, those with atypical depression might find themselves eating more and sleeping more than usual. They might also be hypersensitive to rejection and criticism, feeling deeply hurt by even the slightest perceived slights. Another hallmark of atypical depression is mood reactivity. Even though atypical depression might present differently, it's crucial to remember that it's still a serious condition that requires professional help. Chapter 8: Situational Depression, Coping with Life's Curveballs. Let's talk about a type of depression that's triggered by a specific life event or situation. Situational depression, also known as adjustment disorder. Life is full of ups and downs, and sometimes those downs can be pretty tough to handle. When we experience a major life change, whether it's a job loss, a divorce, a serious illness, or the death of a loved one, it's normal to feel sad, anxious, or overwhelmed. But when those feelings are so intense that they start interfering with our daily life, it might be situational depression. Situational depression is usually temporary. Talking to a therapist, joining a support group, and practicing self-care can make a world of difference in navigating those challenging times. It's okay to ask for help when life throws you a curveball. Chapter 9: Premenstrual Dysphoric Disorder, More Than Just PMS. Let's talk about a condition that affects millions of women, premenstrual dysphoric disorder, or PMDD. Most women are familiar with the ups and downs of premenstrual syndrome, or PMS, but PMDD is a much more severe form that goes beyond just mood swings and cramps. We're talking about a debilitating combination of emotional and physical symptoms that hit in the week or two before a woman's period. Think extreme irritability, anger, anxiety, depression, fatigue, bloating, and breast tenderness. Imagine feeling like your body and mind are hijacked every month. It can disrupt relationships, work life, and overall well-being. The good news is that PMDD is treatable. Lifestyle changes like regular exercise and a healthy diet can help manage symptoms. If you think you might be struggling with PMDD, don't suffer in silence. Talk to your doctor. Outrow: Finding Hope and Healing. Understanding these types of depressive disorders is the first step towards feeling better. Remember, you're not alone in this journey. Talking to a therapist, exploring medication options, and making positive lifestyle changes can make a world of difference. There's no shame in asking for help. You deserve to live a life filled with joy, purpose, and fulfillment. Thank you for watching.